Irritable bowel syndrome (IBS) is a common gastrointestinal disorder that affects the large intestine. It is characterized by a group of symptoms that occur together and affect the digestive system. IBS can significantly impact quality of life, but it does not cause permanent damage to the intestines or lead to serious disease. Here's a comprehensive overview of IBS. Types of IBS. IBS can be classified into several subtypes based on predominant symptoms. IBS with diarrhea (IBSD). Symptoms: frequent loose stools, abdominal cramps, and urgency. Management. Treatment may include medications to reduce diarrhea and dietary changes to manage symptoms. IBS with constipation (IBSC). Symptoms: infrequent bowel movements, hard stools, abdominal discomfort, and bloating. Management. Treatment may involve laxatives, fiber supplements, and dietary modifications. IBS with mixed symptoms (IBSM). Symptoms: alternating between diarrhea and constipation. Management. Treatment aims to address both types of symptoms. IBS and subtype IBSU. Symptoms: a combination of symptoms that don't fit neatly into the other categories. Symptoms. Common symptoms of IBS include abdominal pain, cramping or discomfort often relieved by bowel movements, bloating and gas, feeling of fullness or swelling in the abdomen, changes in bowel habits, variability in stool frequency and consistency, including diarrhea, constipation, or alternating between the two. Mucus and stool. Presence of mucus can be a sign of IBS. Urgency. The sudden, compelling need to have a bowel movement. Causes. The exact cause of IBS is not well understood, but several factors may contribute. Abnormal gut motility. Description: irregularities in the contractions of the intestines can lead to changes in bowel habits. Increased gut sensitivity. Description: the gut may become more sensitive to normal digestive processes or certain foods. Stress and psychological factors. Description: stress and anxiety can exacerbate IBS symptoms or trigger flared UPS. Gut microbiota. Description: imbalances in the gut microbiome may play a role in IBS development. Food intolerances. Description: certain foods or additives may trigger symptoms in some individuals. Post-infectious IBS. Description: IBS symptoms can develop after a gastrointestinal infection. Diagnosis. Diagnosing IBS typically involves medical history and symptoms review. Discussion, review of symptoms, dietary habits, and any potential triggers. Physical examination. Evaluation, checking for signs of gastrointestinal issues and ruling out other conditions. Diagnostic criteria. Rome criteria. Use of standardized criteria e.g., Rome IV criteria to diagnose IBS based on symptom patterns. Exclusion of other conditions. Tests, blood tests, stool tests, or imaging e.g., colonoscopy may be used to rule out other conditions with similar symptoms, such as inflammatory bowel disease (IBD) or celiac disease. Treatment. Treatment for IBS focuses on managing symptoms and improving quality of life. Dietary modifications. Low FODMAP diet, reducing foods high in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols can help manage symptoms. Fiber intake. Adjusting fiber intake depending on the IBS subtype, e.g., increasing fiber for IBSC or reducing it for IBSD. Medications. Antispasmodics, to relieve abdominal cramps and pain. Laxatives, for IBSC to improve bowel movements. Antidiarrheals, for IBSD to reduce diarrhea. Probiotics, may help some individuals by improving gut flora balance. Antidepressants, low doses may be prescribed to help manage pain and mood symptoms. Stress management. Therapies. Cognitive behavioral therapies (CBT), mindfulness, and relaxation techniques to manage stress and anxiety. Lifestyle changes. Regular exercise. Physical activity can help with bowel regularity and reduce stress. Sleep hygiene. Ensuring adequate and quality sleep can improve overall well-being. Prevention. While IBS cannot always be prevented, you can take steps to manage symptoms. Identify triggers. Keeping the food and symptom diary to identify and avoid specific triggers. Balanced diet. Maintaining a diet that supports digestive health and managing food intolerances. Regular physical activity. Engaging in regular exercise to promote overall health and reduce stress. Conclusion: IBS is a manageable condition with a range of treatment options available. If you suspect you have IBS or are struggling with symptoms, consult a healthcare provider for an accurate diagnosis and personalized treatment plan. With appropriate management strategies, most individuals with IBS can lead active and fulfilling lives.